Hey guys, it's Brandy. We're going to look at the bleeding control shock management skill station. Now, in addition to this being a national registry skill, keep in mind that tourniquets are approved in all of your first aid protocols. So just because you're not an EMT or a paramedic doesn't mean this is not going to be applicable. So the first thing I wanted to do was actually pull up the skill sheet. The skill sheet for bleeding control shock management is probably the easiest one that you have. It is comprised of 7 points. They should all make sense as we go through and start remembering what these are. And obviously PPE, right? You've got your gloves on. You're going to respond to someone who is, well, let's do that. Let's give you a call out. You respond to a scene where a 60-something-year-old male was the victim of a robbery. The assailant pulls a knife and happened to stab him right around the brachial artery. So that kind of sets a picture of what it is we're going to be responding to. But as you come down and you know your gloves are on, we're going to come and apply direct pressure to that wound. There's actually a couple of different steps that would certainly be appropriate here. Direct pressure and elevation. Anytime something's working now against gravity, it's going to be a little harder for that to bleed out. So direct pressure and elevation really should be thought of as one step. It's only a single step on your sheet, but no one's going to knock you for elevating that injury site. And there are some key things here as well about what the evaluator tells you. There's going to be 2 responses that the evaluator gives that you're going to want to pay close attention to. The first one is that after you apply direct pressure to the wound continues to bleed. Okay, this is the tourniquet station. So I'm utilizing the combat action tourniquet. They're the same tourniquets that we utilize in the classroom. They're easy to use. I think after we get done with the skill, we can break this apart and just make sure you know what some of those parts and pieces are, in addition to some of the other devices that you can use as a tourniquet. So after you do apply the tourniquet, note that the examiner must now inform the candidate that the patient is showing signs and symptoms of hypoperfusion. Okay, maybe there's an increase in the pulse, drop in the blood pressure. Is this compensated now going into decompensated shock? So we're going to want to position the patient appropriately. Here we would want to lie the patient on their back, elevate those legs, at least 6 inches up, so we can start returning blood to that core. The administration of oxygen, obviously, they've lost their blood. Blood contains those 4 products, the red blood cells, white blood cells, plasma, and platelets. So by returning oxygen, we're trying to compensate for some of that they've actually lost. The initiate steps to prevent heat loss. And just as my reminder, the guy's kind of already wearing his blanket because I'm not going to actually be able to physically move them. So again, just remember the thermal management. And the last step is one that I've seen a lot of students miss. Just call for immediate transport, right? Since you're not actually loading and putting this patient in, these are all verbalized skills that we're doing. So just make sure you always call for the transport. So I'm going to take this page down, and now we're going to take a look at our potential victim over here. And again, let's just kind of build that picture, right? This is that 60-something-year-old male who someone shows up and says, "Hey man, give me money." And he doesn't. And so he gets stabbed. And when he gets hit right in that brachial artery, you're likely to see some type of actual squirting of blood as it's coming out. We might actually put a little bit on a shirt just so you can see that. But as far as my steps go, yeah, I've got my PPE on. I've got my gloves on, and I'm immediately going to come and apply direct pressure to his wound. I don't know if you could see it, but the wound continues to bleed. So what I've done is I've set up the tourniquet. I have not tightened it. It's just the way this setup actually is, that in order to control that, I will now start turning my patient's tourniquet so I can start to make that bleeding cease. You notice once we have that in place, although there are some remnants of blood, looks like we have that secure. So just as I note, just because you've stopped the bleeding doesn't mean your tourniquet is done. There's a time box on here that becomes so important because we want to make sure we document what time we actually put this on. There's about a 4-hour window for skeletal muscle before it's going to start to suffer that permanent damage and death. So I would tell my evaluator, yes, I put the tourniquet on, and then they would express to me, what else are you going to do? Now the patient's showing signs and symptoms of that hypoperfusion. So I need to recognize the need to actually lay that person down, elevate the legs, put them on high flow, high concentration oxygen, 15 liters a minute via non-rebreather. The thermal management is going to be taken care of, and we're going to immediately transport. So again, that is bleeding control. It's that easy. I did mention, we take this off, you can kind of see what a cat looks like, a little more up close and personal, right? But there's the cat. The time window that's on there, that becomes critical. Because again, we need to know, what if you bring this patient into the hospital? He now goes into triage, and 6 hours later, oh, there's no time on here. I guess this person just got here recently. So again, make sure you note that time in the appropriate box. As far as tightening this goes, right, it's simply Velcro, one of the easier things to use. We tighten that up, and then you have this windlass knot. So this is what actually helps to apply that pressure. As you turn, this is going to compress and get tighter. And since it gets the bone, so now it can help to compress the artery. There is also on the back a rigid plate, which is not just mesh, but it's a little harder piece of plastic, because as that actually sits up against the bone, it works to compress that artery. You can see I can actually slow down the bleeding. Other items that are certainly available for use as a tourniquet, what about this? The blood pressure cuff. You can cinch that around the arm, potentially around the leg. You may need a thigh cuff if you're dealing with a femoral bleed, but we simply tighten that up. And the other thing about tourniquets is, let's not take those off till they get to the hospital, right? Let the doctor do that part. If you're able to just stem the flow of that bleeding, keep in mind insanguination is one of the leading causes of deaths in the pre-hospital trauma. They just don't control the bleeding. That's why you may see a lot of information from a program called Stop the Bleed. Some of this was actually taken from that, but honestly, what's most important is that you stop that immediate life threat. Yeah, we recognize that we have to give them oxygen, position them, and transport, but stop someone from bleeding out quickly. Hopefully by the time we get you back into class, we can show you some videos where some people weren't so fortunate. And I can tell you the quickest one I've seen is about 45 seconds. Arterial blood loss comes, and it causes that imbalance to homeostasis very quickly. So hope you enjoyed your tourniquet lesson for the day. I'm going to get my buddy here cleaned up, and we'll see you next time. Thanks.